Okay, I saw here participants. There are some colleagues from National Disaster Management Officer and also Ministry of Education from ASEAN Member States, from Brunei Darussalam, Malaysia, Indonesia, and we have also from our donor, Miss Mary, welcome, and also some colleagues from local or international NGO, school safety organization from Wahana Visi Indonesia, from Plan Nepal, Plan Philippines, and also some NGOs from Africa. Hello, everyone. Wherever you are now, good morning, good afternoon, and good evening. For this third webinar, we have 4 speakers here. As you can see in the agenda, first one is coming from Myanmar, Miss Nin, but I didn't see her, so maybe it will replace with Miss New. Second one is Dr. Marla from Save the Children Australia. Dr. Marla is in US now, and she's the technical working group of ASEAN Safe Schools Initiative. So good evening for Dr. Marla. Thank you for your availability to become a speaker in this evening. And the third one is my colleague, Ms. Ling Ling from Plan International Asia Hub, based in China. Hello, Ms. Ling Ling. And the last one, we have here Professor Aiko, an associate professor from Toyo Eiwa University from Japan. Hello, Professor. Good morning. And then for our moderator in this webinar will be my colleague, Mr. Renar Berandi, as a program manager of ASEAN Safe Schools Initiative. And he is together with me now, and also some colleagues from Wahana Visi Indonesia. Good morning, all.
Good morning.
Good morning.
Okay, let's look to the Zoom guide now. I will just quick to check before we start. We just jump into the slide 6. I think everybody already connect with the audio. If you use for the headset, please to set become the headset earphone, and then for the microphone also you set for the microphone earphone. And then if you want to raise your hands, please to click raise hand here. And then if you finish to ask or give input, please to click for the lower hand. So that's all from me. Enjoy the webinar. I will give to Mr. Renar. Over to you, Mr. Renar.
Thank you very much, Mary, for the introductions. And it's good to be back at the third ASEAN webinar, the ASEAN Safe Schools Initiative webinar. Today we will be having our third webinar with the titles of the focused on approaches in implementing school safety. So there will be also presentations around concepts, frameworks on public awareness, public education, consistent messages regarding the linkages between community and also schools. We're going to hear also concrete from the grassroots perspective, the implementations of how we want to include inclusive elements into the school safety. We're going to hear shortly also about the collaborations and coordinations from our speaker as well. This webinar will last for about 1.5 hours, wherein each presenter will have their 15-minute presentations followed by questions and answer for another 15 minutes. This webinar is fully supported by the International Federations of Red Cross and Red Crescents, the Asia Pacific Coalitions on School Safety, and funded by the ECHO. I think Melly already said that, but then before we proceed, let me just also remind you all of the guidance for this webinar. If you would like to pose a questions, for example, please kindly wait until the questions and answer sessions. Raise your hand by using the icon of raise your hand. I will call on your name and please state your questions and to whom you will ask the questions to. During a presentations, for example, you may leave your questions in the chat box. So I will be working closely with Melly to monitor the chat box to see if there is questions already. and then we will read out the questions while we reach the discussion session. So please also indicate which presenters you're going to address the questions to. Today's webinar is very special indeed. That I have the honors to be moderating a panelist of women presenters, all female presenters coming from different regions and also from within the region as well. So we have Miss Lin Phu Min from Myanmar. I cannot see her now, so we can have also other representatives from the Red Cross as well to come in her place. And we do have Dr. Marla sitting in the United States. I mean, she's from Save the Children's and willing to also share about public awareness and public education, key messages. We do have Miss Ling Ling sitting in China. She's gonna focus on concrete examples and good practices on inclusions and school safety and inclusive disaster risk reductions and management. And then last but not least, that will be also Professor Sakurai. Thank you very much, Professor Sakurai, for joining from Japan. She's going to highlight about the collaborations and coordinations and how we want to foster school safety, link up with the community as well. So with no further ado, I'd like to first invite Ms. Nin Yu Min. I'm not sure whether she's already there. Melly, can you advise? All right. So I think it's not. She's not there yet. Before I proceed, let me just also remind you to mute your microphone when you are not speaking, so that we can have clear voices coming out from our presenter. Since Ms. Nin is not yet there, she has not joined the webinar, I would like to firstly invite Dr. Marla from Save the Children Australia to initiate and start off with her presentations. Let me please introduce Dr. Marla Petal. Dr. Marla Petal is our principal advisor for urban resilience and school safety for Save the Children. Her education includes a PhD in urban planning and Master of Social Welfare with a focus on community organizations, planning, and also administrations. She has worked in policy, programming, educational materials development, training, and research, and led large-scale urban risk education programs and design online self-study course. Her interests are around comprehensive school safety, social and behavioral change communications, evidence-based actions-oriented key messaging, structural awareness for seismic safety, games and music for change, scalability, sustainability, and equity. So it's a long introduction, and let's take a listen to Dr. Marla Petal. She's gonna present us about public awareness and public education's consistent key messages for household and community. Dr. Marla Petal, over to you.
Well, thank you very much indeed. It was such a long introduction. I wasn't planning to reveal my age, but I think by my interests, my age got revealed as well. The longer you're around, the more interests happen, I guess. Okay, what I want to just find out from all of you, you can pitch in or you can say, you know, raise your hand, say yes or whatever. How many of you are aware of and have participated in some way in the adaptation and adoption of public awareness and public education action-oriented key messages in your country? If you have, let me know so I get a little bit of an idea. And otherwise I'm kind of starting from the beginning. So this project started with IFRC in about 2000 and maybe 10. And what they found as they were looking at how to engage national societies in public awareness campaigns and public education campaigns, you know, they had lots of ideas for, you know, how to go about implementing and wonderful activities. And we've seen these all over the world. But the question that arose was, yeah, but what's the campaign about? And what is the change that we're trying to bring about? What is this campaign going to accomplish? What is the behavior that we need to see? Yes. Can everybody hear okay, Renar?
Yes, yes, Marla, just, yeah, carry on. I think we already grant the control over to you. Yeah.
Okay. Okay.
Dr. Marla, before you proceed,
Need everybody else to mute, please.
mute your speaker, please.
Somebody is controlling the slides other than me.
Let me just also remind all the participants to mute your speaker, to mute your mic, because we're about to hear the presentations from Dr. Marla.
To mute. Mute everybody to mute. We still have quite a bit of sound.
Right, now it's fading away already, the sound. So Dr. Marla, please carry on.
I think, Nelly, you're not on mute. Sorry. Okay, I'll continue. And hopefully I will have control of the slides. Okay, so the question came up, you know, well, what is the behavior change we're seeking? What are these messages all over the world? You know, everybody from the Sendai framework on, Hyogo framework on said public education was so important, but what are we trying to accomplish? So we realized that, you know, the kind of change that we have to accomplish at the household level is extremely important. Because all of the things that we want to accomplish, whether it's schools or workplace or businesses or public institutions, local government, subnational government, all of these things are great, but we really need, and we have the most agency, the most capacity within the sphere that we control, which is our own household. So we started off looking and researching into these messages for household safety. And, oops, sorry, oh, wow. Okay, my clicker is clicking away like crazy, even though okay, something weird is happening to the clicker here. Sorry guys, I'm trying to get to the beginning. Oh, no, I got to the end instead of the beginning. Sorry, Melly, can you just launch me again, and I think it might be that more than one person has control over these slides.
Hey Marla, yeah, please try again. If it doesn't work, then we can actually control it from here.
Okay.
Yeah.
There's always a bit of a delay, so. Okay, I am now clicking one by one. Okay, so let me tell you how this came about. And the intention was always with these public awareness, public education key messages that we would create a global template, which is all the scientifically based, evidence-based, action-oriented key messages. And then subject matter experts in each country would be brought together in order to adapt those messages for the national context and adopt them. And what they would be doing is creating a reference and an agreed upon consensus-based set of messages so that everybody could be pushing in the same direction with the same voice. The research has told us very clearly that, that people will take action when they feel that they can be effective in the action, that the actions themselves are worthwhile, when they know that they can do them, and when there's consensus about them. When they start to hear different messages from all over the place, they basically say, nobody knows what they're talking about, so I can ignore that. So anyway, happy to say that the messages have been adapted and adopted already in Bhutan, China, Fiji, Laos, PDR, Philippines, Solomon Islands, Thailand almost finished, and Vanuatu, and Philippines is revising right now. Laos is also updating. And the first edition was translated into a lot of languages. Now let's look at how we got there. Well, it was done through a lot of action research, a review of 300 documents and websites, interviews with 50 staff and volunteers worldwide initially. And then we went to 17 very authoritative sources. These are international, institutes with different specialties. Interdisciplinary global workshop with 23 national societies. We then submitted the draft to subject matter experts and interested organizations, and they all input. It was very, very well received in those countries where we started implementing. People really appreciated and saw the need for it. Now, what is this going to be used for? Well, it's a reference. It's a reference for these public awareness and safety campaigns, for social and behavior change and information and educational materials. And it's also a reference for the content for formal and informal education. Because these are action-oriented key messages, it means we can actually use them in a way as a monitoring and evaluation device to see if we're making an impact. So the messages have already been used by a number of different sources, social, campaign developers, social and behavior change material designers, curriculum developers have used these materials. It's really the foundation for Pillar 3 risk reduction and resilience education. So it's been a contribution to the work of ADRES and the Worldwide Initiative for Safe Schools. Games and app content developers have been using it as well. There's a number of new apps that have applied these and used it as a kind of a means of checking the content that they propose to teach. And so we're also seeing it used by instructional designers and video developers. You can see that we expanded the messages to include standard operating procedures for disasters and emergencies in schools in the 2018 version. And so we're seeing it being used there as well. And it's also being used in research. For baseline and endline and looking at what kind of change we can accomplish. And we're even seeing that, that there's intergenerational learning and that with children taking the messages are translated, for example, who's not mute. Can we get everybody to check the mute? Thanks. We're seeing that when we boiled this down. Sorry, did somebody need to say something?
No, I think carry on, Dr. Mala. Yeah.
Okay. The messages are the foundation for a family safety plan that can be developed, just like a 2-page document to guide family safety, and I'll show you a little bit about what's different about that. So basically, all of us should be using this. Now, very interesting here. The slides are all over the place. Sorry. Somehow the slides I was intending to show you are not in the order I was intending to show, but never mind. We will nevertheless hope that the relevant slides show up in a little bit. Okay. So the document itself, the template, is organized into Three major sections. The first section is on key messages for all hazards, family and household disaster prevention. So in that set of messages, we're really talking about the things that apply no matter what the hazard is. These are the things that you have to do to be prepared as a family. And then in the next section, we go to the hazard-specific messages. And the reason for this is the following. We were finding that when people were doing disaster and emergency planning, they were thinking that they had to have separate plans for every single hazard. And it was leading them to have hundreds and hundreds of pages of plans, and nobody knew what was in the plans, and they were very repetitious, and they kind of were making people crazy. And when you take a real all hazards approach, you realize that the value of that is that, you know, we should be prepared for any and all hazards, and most of them have a lot in common. So in the first edition, we covered the 6 key specific hazards that you can see there. And then in the second edition, we added extreme heat, extreme cold, landslides, debris flow, tsunami, volcanic eruptions, hailstorms, and chemical, biological, and nuclear hazards. And we're going on and now adding road safety, water safety, air pollution, and power outage. In the meantime, we already have, in the second edition, a section on child protection in disasters and emergencies. And that's for the household level, remember that. All of this is for the household level. So whereas a lot of what you've read about in terms of guidance for child protection is geared towards the community level, all of these messages are geared towards the household level. So it really has a very specific audience. Now, the template is the messages for schools, and it's really simple. It's based on standard operating procedures for disasters and emergencies in schools. So we introduce a decision tree that will help you choose the safest action in any particular situation. And then the 6 core standard operating procedures, which are safe building evacuation, assemble and shelter outside, evacuation to a safe haven, shelter in place, lockdown, and safe family reunification. I don't know if you can see my cursor here. And then there are also hazard-specific safety rules, which include for fire, earthquake, tsunami, flood, storm, and hazardous materials. We work then on turning that knowledge into action and with some guidance and preparedness checklists for schools. Did somebody need to say something? We're hearing another conversation. Sorry, thanks. Okay, so look. Oh, hi, Krista. Sorry we missed you. Glad to have you with us. Okay, so the old approach you would get a laundry list and experts would tell you to do all this stuff and you had to like try and memorize. And if you ever play that game where you try to memorize all the stuff and you know, you really can only remember a few of them. So, you know, that didn't seem very, not very scientific in terms of getting people involved. And then another old approach was that everything would be organized according to before, during, and after, which is actually makes a lot of sense. And it does help us to understand and think things through to some extent. But the misleading thing about this is that actually all of that stuff that is for before, during, and after, you have to do 90% of it before. So it was a little misleading in terms of getting people to actually do the stuff in advance. In fact, the scientific literature led us to organize the messages in 3 categories: assess and plan, mitigate and protect, and develop response capacity. And what's interesting about this framework is that it applies whether you're talking about micro level at the household, meso level at the school or workplace, and macro level at government. These three categories of things, actually you can divide all this stuff that we do in disaster risk reduction into these three categories. Of course, education goes across all of them. But, oops, sorry, it's me not too accurate on my pointer here. Now, what about inclusion, you might want to know? Well, inclusion is included throughout. Our inclusion consultants said we do not want to be segregated and have a separate kind of set of messages for people with disabilities. Everybody has to learn this. Everybody has to be sensitized. Everybody has to be aware and think of one another and think about people of all ages and all abilities and all kinds of functional and communication needs. So let's not make this an us or them thing. So that was kind of interesting. Now, suppose you take these key messages and you want to adapt, localize, and adopt them in your country. What do you do first? Well, the protocol that we suggest, and we do ask that Red Cross and Save the Children are invited to participate in this process, but any organization in the country that wants to take the lead is most welcome to meet with the National Disaster Management Organization to make a preliminary plan, to prepare the key messages, have them all translated for review. In most cases, we've done this with a 2-day national workshop, but in some larger countries, it takes a longer time, and we really just sort of set up a series of workshops with different subject matter expert groups. So you prepare for those workshops, conduct the workshops, and then compile and edit the inputs and circulate a draft, and then finalize and publish. So let's see what this looks like. On the first day, the focus is on the All Hazards Household Safety Plan, and everybody goes around with a bunch of colored stickers and votes on whether these things are must, may, must, should, or may do. The must ones are the ones that come right to the top. We want to really push those out. Should are also great to do. And we want people to know about it. And if people are very enthusiastic, we hope they'll go on and do the may do messages. And then some of them, if they think the messages are not applicable, they just cross them off completely with a different color sticker. Now we've separated all these messages into a core message versus the contextualized message. And so if I can give you an example, I think I have it on another slide, but an example of a core message is be able to put out a small fire. Now, an example of the contextualized details are be able to use a fire extinguisher and learn to do pull, aim, squeeze, sweep to operate the fire extinguisher. Whereas for somebody who doesn't have access to a fire extinguisher, the contextual detail messages have a bucket of sand or a blanket ready to put out a fire. So, we try to be sensitive to all the different contexts. And because people move around, most countries have wanted to have all the messages work for urban and rural environments. They don't want them separated because they know that somebody in a rural environment today might be in an urban environment tomorrow. Okay, so then after the votes, the paper comes down off the wall and everybody divides up into table groups that can work together. And then they start to take those notes and votes and work on refining the language and the details. On day 2, they do the same thing with the specific hazard messages. And usually you're able to divide this into groups of the different experts, the hydrometeorological, geological, public health, and the school safety and child protection. And as again, in a small country, you can do this all in one room in the capital city, but in larger countries and federated states, we've even done some of this consultation online. So it's really context specific. And once the whole thing has been, refined, then the group comes together to decide on what they're going to do as far as next steps for implementation. So, so that was our kickoff group in China, but then we had a year of online consultations as well. So what we'd like to encourage you to do next is check out the Public Awareness Public Education website. We think that there's a lot more work that can be done to extend this internationally. And then what we've done in some cases is really see the translation of this core resource into practice, where we're developing the social behavior change campaigns, the family safety plans, the curriculum materials, and seeing, you know, how we can really then measure the behavior change at a local and societal level. I think that hopefully is it for me. Thank you.
Thank you, Dr. Marla Patel, for this comprehensive explanations about the public awareness and public education as well. She mentions about the purpose of having this PAPE, the public awareness and public educations, and she also work us through the steps to developing this documents as well, PAPE, and it needs to be context-based. As well. And she mentions an important elements of this PAPE, which is inclusions. Inclusions needs to be included throughout the whole process, and messages very specific for inclusions as well. So let's move on to the other presenter. She is Miss Ling Yu, sitting in China. Ling Liu, sitting in China. She's actually Plan International Disaster Risk Management Coordinator. She's been experiencing in school safety and inclusive DRR for about a couple of years. And her countries, the target countries that she's actually focusing on is Bangladesh, Philippines, and also Nepal. So we're going to hear shortly the experiences and also good practices on how we include the inclusive aspects of school safety and how we link this up with the community as well. Before I proceed, I would like to also remind everyone, if you are interested in asking the questions, you can leave the message in the chat box, or you can wait until the questions and answer session. So Ling, bring it on. Thank you.
Hello, everyone. Thanks, Rana, for the introduction and the startup. And also, it was very nice to hear Dr. Marla first, as she also mentioned some of the inclusions in her key message and also the public education of DRR. Nelly, can you give me the co-host authority? I cannot move my slides.
Yes, already you can try it, Miu, because the arrow is in the left below, and then because your screen is white, so maybe, yeah.
Okay. Okay, thank you very much. So I will just introduce the current practices in my two projects. More concretely in the projects I manage in Nepal, Bangladesh, and also Philippines. But for the two projects, we will talk more how do we work on inclusive disaster risk reduction. Okay, so for our inclusive work, we refer to the CBM policies, key principles from inclusive disaster risk reduction. But this is more focusing on the disability. We use that as for the general inclusion. For the first stage, we work on inclusion. Participation is what we focus a lot, and also the twin track approach, accessibility for all, that is more on the infrastructures accessible for all, and also the services we have in the project activities. And then we also try to build the back better, the safe environment, also the other capacity and also skills, and also removing excluding factors like social norms, stereotypes. We assess that in our projects, and then we also have activities to remove that as much as we can, and also coordination and collaboration. For example, in Nepal and also in Bangladesh, even in Philippines, we already got so many good policy papers, such as Safe School policy that is endorsed by the government, but removed to the concrete implementation of these policies in the field is still a little bit the gap we can see in the field. So we are trying to coordinate with government and also collaborate with other organizations. So in the target schools or in the project area, we can work together to support the implementation of the governmental policies on safe school, for example. And what I want to highlight here a little bit is inclusive actually include a lot. Dr. Mala had mentioned all hazards, so different type of hazards, but also we need to include so many different people. But for the current policies, guidelines, or the framework available, so much are still only disability. For the others, like include the LGBTIQ, for example, indigenous people, or other types of elder women, we don't see much. So it's really, we still work on the current practices and we just build our way as we go. So for my projects, previously we have a lot of safe school projects. So it's mainly we work in the schools, but now when we move to next phase or after 2 or 3 years, we work both in school and communities. It means we really have community activities. And then for all of the activities, we include children, women, adolescents, elder, persons with disabilities, LGBTIQ+, and also the indigenous people in DRR, and also emergency preparedness planning. So we really hope that we can make our school and also community-based DRR, children, women, and all the people, I mean, everyone, inclusive. And I can give you some concrete examples from Philippines. I think my Philippine colleagues are also here today. So if anything you feel like free, then you can add also. So we use this HVCA process. I think all of you sit here today, you are very familiar with the HVCA process. So we still have HVCA as a tool from the very beginning to assess what are the hazards, what are the vulnerability, and also what are the capacity or the resource available in the communities and also in the schools. But this process, we had that with the participation of different groups of people in the community or in the schools, because we really want to involve anyone, everyone, to ensure that none of them will be left behind during emergencies. So for the assessment, they participate and then they tell you what the experience is, and then they tell you what are the needs, and they tell you what might be the solutions to support the school or the community contingency process, evacuation drills, and also the environment, etc. And then particularly for children, and for example, for girls, we really want to hear from them what differently their life affected by different type of hazards during disasters or before for the preparedness work. Were they involved? Did they participate in the drills or not? And why was the reason? That's what we looked at the HVCA process. And then with all of their participation, and we could assess the risk, and also like what we have a general picture from the schools and the communities. So from the picture you can see in Philippines, elder people are there. So with all of their participation, and with this process is not like one activity or like with one group of people. It can be finalized one day or after one single activity. It normally continues for a bit longer time, 1 week, 2 weeks. It can be very long sometimes when the community are very big, because we really want to have a generic participation with most of the people, even all of them. And then we also have this inclusive evacuation management and operations drills with participation of vulnerable sectors and also partners as observers. So with the available and accessible inclusive contingency plan in a community with a clear inclusive evacuation management and operations plan, we organize evacuations in the communities to test how it works. So the presence of spaces for women, pregnant mothers, elderly, in Philippines they call it senior citizens, child-friendly spaces, person with disabilities, LGBTIQ+, and also the indigenous people in the evacuation centers. And the prioritization of vulnerable groups in the evacuation is what they practiced and also tested to say, is that really works, what they write on paper or what they agreed before in the planning, is that works well. And then the committee members are properly oriented before the evacuation. For the committees, we also managed that at different steps. Step one, we review the current committees to see how is the formation of the members. Are there women sit there? Is there any other groups of people, such as people with disabilities, also have representative in this committee? So we review that, and then we will reform it if there is a need to include more people, such as female, PWD, indigenous people, as I mentioned before. After we reformed it, and then we give orientation training to let people understand the different issues we assessed before as a general, and then also like climate change, DRR, gender, child protection. So that will be a kind of a supporting capacity building for them to have their roles and also the responsibilities functioning well during, before, and also after the disasters. And then we also organize school drills. So when they organize evacuation drills in the communities, they involve schools, but not at the full scale so far. And also for the school drills, the same process, but not involved in the community very, very comprehensively. So that it will be our next step. That is kind of the inclusive activities from Philippines we are working. Yes, so from the pictures you can see in the schools we organize these evacuation drills. So schools, teachers, and also some of the community workers, they are involved in the process to really experience and also test the SOPs, evacuation contingency plans. Is that worked well? Any space to improve? They have also some of the first aid elements to see how it works. And also in the community evacuation drills, from the picture 3 at the left bottom, you can see that is the evacuation drill. So after the community people are evacuated to the center, and then there is a desk, people need to line up and also register themselves. And so the community worker or the social worker, they will know how many they are evacuated here, how many are still left, how many they still need to do the research. And also for the lactating area, you can see we have only 4 pictures here, but actually there are so many different spaces they identified and arranged for the different groups of people. For example, the lactating women. So after this check-in registration process, the lactating area, women can carry their kids and go there for breastfeeding or other kind of things they can do from the center. And then they also have another identified area for people with disability, and the social workers will help and bring them there. And some special services will be provided there. And also they have a space for the senior citizens. So the senior citizens, they will do a health check after this registration, and then they will be arranged and guided to go to their space. And also the child-friendly space. So children, a bit elder children, they can go to the child-friendly space. They can play there with taking care of these community social workers or volunteers. So that's what we're doing right now. And also we are trying to include the kind of gender disability, like the culture sensitivity mainstreaming in DRM planning, and also the development program. So we're trying to work with the local government officials, departments, such as the different levels, municipal level and also the barangay level, and then working together with them for the regular preparedness work and also for the emergency response work. So by together their work, they could have some of the common agreements, such as the committees. So now from Philippines, now we received a letter from the municipal, so they can request all of the schools and the communities, they should form a committee for disaster risk management. And then in this committee, they request different positions such as chairman, and also the formation of members, composition of the members, like female, male, or the roles of the responsibilities. And it's a common requirement for all. So all of the area, all the schools and communities, they will do the same. So that's what we are doing for coordination, collaboration, and streaming as well. So same process for Bangladesh when we do this inclusive DRR. More we work is on like build back better, service and infrastructures accessible for all, and also removing the exclusive factors, coordination, collaboration. That's the focus of our two projects at the moment to have our project more and more inclusive. For example, in Bangladesh, before they had a committee, but they don't have any person with disabilities or any person like LGBTIQ+, even no female before. But after our project, we reviewed and we reformed the committees, and now we have actually we have more than one, but he is example, like he used wheelchair. And then the office for the meeting is always like this. He couldn't access to that. And then for the committees, they have to identify roles and responsibilities. They need to help him. They have to organize activities also. He could participate. And then this is another example in Bangladesh as well. This person is basically a transgender, and she is not a hidden population, at least. So people could invite her to attend the committee meetings, and now he's a committee member, and also he is leading some of the roles, like to do the community mobilization by drama, by other activities to disseminate the key messages for DRR. And now it's a big group of people. He could work together with them. And also for the vulnerable and indigenous and also the religious minority, that is also the target of our project. So we could involve them, invite them to participate. It's really difficult to have female participation from Bangladesh, for example. And if they are kind of indigenous, it's even more difficult. But from the project by the youth groups, by the children working groups, they could reach. We have organized the different task force groups by children, youth, so they could reach to the different communities one by one household by one household. So more people than our expectation, they could come and also participate to the project activities. So that's basically the current practices we want to share here. But I also want to mention the challenge, because as I mentioned before, inclusive, actually we have, if you want to be inclusive for all of the activities, you have to include so many people. I mean, if the target, the objective of your project is leave no one behind during emergency, then each single person should be in this process. And then it's a challenge to reach every person in the community. Schools is a bit easier, but in the community it's not that different, that easy. So different types of disability, for example, is a challenge. And also the female participation, as I mentioned, because actually your project cannot be truly inclusive without gender transformative, but only 3 years project, and also change the social position after 3 years without their participation. It's kind of the challenging. So we are still in the process, and also identify the hidden populations. The transgender person I mentioned is, I mean, he is out of the box. So people know this is a transgender, but for some indigenous and also the LGBTIQ, they don't come out, or it's kind of, they don't participate in any activities. Even the people with disabilities, that like children, parents don't allow, so many different reasons, but you cannot just include them into this process. So that's also the challenge we face. But again, already we see some positive change in the communities at the schools, at least from the committee, a lot of positive change. We already see people can express their voices, and also the evacuation drills, you see more and more people at least participate, because you know there is a space for them. They can recognize you as a person with need. So we are still in the process. I don't have so much evidence to show you now, like the result and also the data. Hopefully I will have another chance after the 3 years project to brief you more. I think that's all of my presentation today. Thank you very much for your time.
Thank you, Lily, for the great sharing as well, coming out from your project and also activities as well. I think from Ling's presentations, we all actually learned that it's not really that easy to be inclusive and to be inclusive, and to what extent we would like to be inclusive in our school safety project. But there is also a highlight over here as well, that school safety implementations is part of the community-based disaster risk reductions as well. Ling mentions about removing barriers for people with disability, but also increasing the representations and participations as well. And it's certainly is a journey. It's not a one-off activity that can actually achieve the ultimate goal as well. I think the interesting part as well to know that no one is left behind, but to what extent we're going to be very inclusive for our project. And I think a highlight from Ling presentations as well is that no one is hidden. So there is hidden populations, and how do we want to make sure that they are participating in the whole process of evacuations plan developments, and also HEADS VCA as well. Lini also mentions about the collaborations of all these stakeholders, community members, and then also the segments of community as well, because community is very general. Government, municipalities, municipal government, as well as barangay level government as well, people with disabilities, senior citizens, people of ethnic minority, for examples. Let's also hear from Professor Sakurai, the experience from Japan directly, as far as the collaborations and multi-stakeholder coordinations is concerned when it comes to developing school safety initiatives and evacuations plan as well. Professor Sakurai is Professor Sakurai research focuses on comprehensive and sustainable school disaster safety. Since 2011, Great East Japan earthquake and tsunami disaster, she started her career in disaster recovery and disaster risk reductions by joining Save the Children Japan. She is currently associate professor in departments of social sciences, Toyo Eiwa University, Japan, and a member of School DRR promoting community of Ishinomaki City, Miyagi Prefectures. She is also a board member of SITS Asia, Japan-based NGO focusing on disaster risk reductions educations, and a co-editor of a book, Disaster Resilience of Education Systems, Experiences from Japan. So Professor Sakurai, time is yours now.
Hello, can you hear me now?
Yes, loud and clear.
Great. Thank you very much, everyone. It's my pleasure to have opportunity to share the Japanese experience of enhancing school safety to all the ASEAN countries. So as you know, Japan is a quite disaster-prone country, and then our school safety has been developed since the 1995 Hanshin earthquake, but that is mainly focusing on the earthquake. Anyway, since we have many earthquakes, so then our school safety has been evolved based on lessons learned from the past disaster experiences. And then our school safety has been led by the Ministry of Education. Since the 1995, our school has become safer against earthquakes. So this is left graph is the earthquake resistance rate of all the public schools. And then right picture is a supplemental material on the school safety, how the school could prepare for the disaster manual and disaster education in the existing curricula. These materials are offered by the Ministry of Education of Japan. However, when the 2011 disaster happened, we had serious issues on school safety. We found that our schools are not safe against tsunami. So 193 schools were quite destroyed. And then 645 teachers and children and the school staff were killed by the 2011 disaster. So this is because many schools are located near the coast and not many schools prepared for tsunami evacuation. So this tragic Okawa Elementary School accident occurred in Ishinomaki, where 74 children were lost their lives by the tsunami hit. School was located at the riverside of Kitakami River. There was no principal at school on that day. Teacher did not know where to evacuate children after they got together at the school ground. When they decided to go to a higher place near the river, they were swept by the tsunami. This is a building picture. The school building was a two-story. There's no access to the ceiling, to the rooftop. This is the inside of the school building. This is kept as a memorial facility to transmit the experience to the next generation now. So the top picture shows, with a red circle, shows this is where the children and teacher try to evacuate. However, on the bottom picture, you can see the mountain behind the school building. Why they did not evacuate to the mountain behind the school? So this is the tsunami hazard map prepared by the prefecture government before the 2011 disaster. You can see the red circle at the bottom of the hazard map. This is where the Okawa Elementary School was located. The school was outside of the tsunami inundation area, and the school was a designated evacuation shelter for tsunami. 23 victims of family sued the prefecture and the city government after the disaster. In April 2018, High Court decision was made. It said the school has obligation to set a third evacuation area against tsunami and to clarify evacuation areas and routes in its risk management manual in advance. The prefecture and the city government are appealing to the Supreme Court now, so the case is still going on. So why the court decision was made? This is because in Japan, the school is legally and institutionally responsible for securing children's lives at the school based on the School Health and Safety Act of 2009. So school is mainly responsible for children's lives during the disaster at the school. So what could we do to not repeat the same tragic event during the disaster, and how could school protect children's lives? Important lessons is how we could localize school safety efforts according to each school's local disaster risk. Another lesson is school teachers do not know about the community much because they are transferred regularly to other schools. So community knows the best about the school. So then when they prepare the school safety or school disaster response manual, they need to work with the community and local educational authorities. So based on the lessons learned in Ishinomaki City, all the public schools are required to set up a liaison committee on DRR to strengthen collaboration with the community, the local government office, and others. So this is one of the multiple collaboration among the local stakeholders. So this is the example of disaster education in Ishinomaki after the 2011 tsunami disaster. Schools are recording the recovery of the community school district and to display all the recovery progress in the map. So this is conducted from school year 2012 and 2014. In the 3 years after 1 year from the tsunami disaster, the records of how much progress were made in the school district was done by the children's hands. After we have expanded the program to the wider area in Ishinomaki, we started to more focus on the DRR phase and then started to utilize topographic maps for understanding local disaster risk. The photo on the left, the map is topo maps. You can see that this is one of the school districts. The whole area is a plain field and then only the mountain behind. The right map is a tsunami inundation map. In the red is where tsunami inundated. So compared to these two maps, you can see that whole the school district was inundated by the tsunami, and then only the mountain was a safer place. So having that kind of information, we also try to provide training to teachers to increase their map reading skills, because to localize the school disaster safety efforts at the local condition, teachers need to understand how to read map and then how to understand the hazard map. Even beyond the hazard map, they need to identify their local risk according to the Okawa Elementary School. Oops, I want to go back to, okay. Oh, sorry. Oh, how can I go back?
Yeah, we can do it from here, Professor.
Thank you.
Go back.
I'm so glad it wasn't only me. Thank you.
Yes. Okay, I can see the arrow here now. Okay. Okay. Yeah. This is also, we provide the teacher's guidebook on how to implement the mapping program and how to utilize topo maps for their disaster education. And after that, okay, this is the 2018 disaster education activity at the same school. The reconstruction mapping program was made. So in 2018, fourth grade students learned from the previous years, children made reconstruction mapping, and then in addition to the inundation area, they try to understand how much height of tsunami came to their own school district. There's many signs. You can see the blue signs. This is how much height of tsunami came. This is prepared by the prefecture government. And then also green sign is a tsunami evacuation building, also provided by the central government. So children try to understand what the sign means. And then also some, how to say the words in Japanese. This is that according to the 2012 to 2014 maps, children show that how much of height of tsunami came based on the community interview. So they understood how much height of tsunami came to which point, and then why they need to evacuate to the tsunami evacuation building. This is quite a localized disaster education approach as an example. So then role of academia, in my case. So as a academia, first of all, we could make a longer term commitment. So we don't need to much care about the funding because we are working as a research fund from the university. And also we are working closely with the Board of Education. So we didn't approach to each individual and then try to cover the whole schools in the city. And then as an expert, we formulated a team with different backgrounds like a geographers, earthquake engineer, or pedagogy, and then try to listen to what they need, you know, from the school, and then what's the reality of the school, because teachers are busy. So even though as a university researcher, they believe that this is important, but that they couldn't have much time to do everything. So this is what we try to do. And also we provide data and evidence and try to improve the program. This is a role of academia. And then we try to be a facilitator of among the multiple stakeholders, try to enhance school safety in the city, because the city government is quite stuck with a lawsuit now. So this is a quite unique case, but this is how academia works in Ishinomaki. So lastly, I would like to mention about the school evacuation shelter, because after the 2011 tsunami, we have experienced many disasters in Japan. And every time we had a big disaster, schools were used as an evacuation shelter. And then because of the evacuation shelter, sometimes the school resumption is delayed. So how we could improve this situation is a quite hot topic right now in Japan. The negative impact to education, you know, when the schools are used as a shelter is a teacher need to take care of children and evacuees at the same time during the crisis period. And then also then all the school classrooms and then gymnastics are occupied, school could not be opened. And then also when the people came, quite a big number of people, in the case of 2011 tsunami, at one school, we had 2,000 evacuees. So then lots of high risk of damages to the school facility. And then when the classroom and gymnastic or playground could not be used, children's mental and the physical conditions were, you know, concerned. So then we really need to have a disaster preparedness, including shelter operation drill, when we think about the disaster management or evacuation drill. And then again, this needs a collaboration between school and the community, because community people use the evacuation shelter. So how much relation they could have, the school could have with community would make difference for having the smooth operation of shelter. So this is another example of a She's Asia project in Myanmar. She's Asia tried to promote the school community shelter because that all the areas are inundated by flooding every year. So this is the opening ceremony of the school shelter. But in addition to providing school shelter, She's Asia also helped the school to work with community to discuss about how to use a school shelter with the community people without try to minimize the impact to the school education. And then also community people work together to identify local risk, you know, which part would be damaged by the flooding and which houses are more vulnerable to compared to others. So these kind of package are given when they, you know, implemented the project on school shelter project. So the full package of this kind of, you know, sets of activities are needed when we have a school shelter. So this is one of the example. And at the end, for sustainable, effective implementation of school safety, this is a quite key, you know, issue in Japan in terms of school safety, because we already have a key message, we already have an institution, we already have a disaster management, we already have disaster education, but not all the schools. And then also only having kind of the school safety, thing is not enough. How to make it effective to save children's lives? This is what we have experienced in Japan. That's why this is quite not normal to share the failure experience to the international community, but this is quite awkward, but this is very important. You know, how to make it effective and how to make it sustainable by the school and the community. So we believe that the supporting capacity development of school and educational authorities are quite important for the sustainability, and then also making the community involved in the school disaster efforts. School disaster safety and community disaster safety are common issues. So how school and community work together is important. And then also, you know, the local disaster risk is different. So what would be done to which school? And then that would be prioritize minimum essentials among full package of school safety activity is also needed for each school. So then making general disaster preparedness efforts fitting to local disaster risk. So this is what we do based on Japanese experience for the successful and effective implementation of school safety. Thank you very much.
Thank you very much, Professor Sakurai, for the presentations. I think we learned a lot from Professor Sakurai about localizing school safety efforts and how we want to foster the collaborations between schools and also community, because school safety and community safety, they are all actually common interest. While Professor Sakurai actually shared us about the hazard, which is actually earthquake and tsunami affecting children access to education in Japan, we now go back to the regions, ASEAN regions. We'll go to the experience from Myanmar Red Cross Society. They're going to highlight us about the road safety, which is a daily risk in ASEAN that prevents children from accessing their educations, right? I'm going to invite Miyu Kimura, who's actually our colleague coming from the International Federations of Red Cross and Red Crescents, to guide us through the presentations. Miyu, over to you.
Thank you, Rena. Hi everyone, can you hear me? I'm very sorry, I'm actually out of office and sitting in a cafe, so I may have a music background, but can you hear me well, or can I speak a bit louder?
It's clear, but then it would be better if you speak louder a bit.
Okay, yeah, I try my best then. How does it sound right now? Hello?
It's better now, yeah.
Okay, yeah. So thank you so much for this opportunity. So actually, yes, as you can see, this is an example from Myanmar Red Cross. My name is Miyu Kimura from International Federation of Red Cross and Red Crescent Societies. And we were supposed to have Myanmar Red Cross colleague, but unfortunately she felt sick and she couldn't make it. So on behalf of Myanmar Red Cross colleagues, I'm very pleased to have this opportunity and to introduce the example from Myanmar Red Cross. So as many of you may know, Red Cross, we have local presence in each country, and we have a lot of school-based activities for different thematic areas. When we say school safety, usually we talk about disaster risk reduction or health or hygiene promotion, I think. But we, Red Cross, Red Crescent, national societies cover different areas based on the needs and expectations from the countries. So this time, Myanmar Red Cross, although they also carry out DRR, school-based disaster risk reduction activities, this time we are happy to introduce road safety action in schools. So how can I go to the next slide? Sorry, maybe I think you already gave me the control right, but how can I go to the next slide? Sorry for this technical issue for me as well.
Yeah, sorry for that, Miyu. So you just can you just click on the screen and then that would move. There you go.
Yeah, okay, great, thank you. So yes, so Myanmar Red Cross objective for this road safety school activity is, of course, to raise awareness of road safety among Myanmar children. So in Asia, as I understand, or in globally, road traffic accidents are the 8th highest killer out of any other diseases, any other causes of death. And road accidents, especially for young people, aged between 15 to 29 years old, it's a #1 killer. Road accidents are #1 killer in the world. And also for children, aged between 5 to 14 years old, it's the second most common cause of death. So that's why road safety for kids going to school, going back home, they really need to know what is important for them to be aware when they go to schools. So that's why Myanmar Red Cross, they also focus on road safety. Okay, so it seems again, could you make the slides going back to the second slide? Sorry, I think I can only go forward. Okay, maybe. Okay, now I can find the button. Yep, thank you. So
Which
to
one
raise,
you, sorry?
yeah, this one, yes, thank you right now.
All right, sure.
So yes, coming back to the objective. So yes, because of this situation, road traffic is most common killer for children, and that's why Myanmar Red Cross focusing on raising awareness and also to develop the manuals and to change behavior of children, and through children also to educate parents, family, and also communities, and ultimately to reduce traffic accidents as much as possible across Myanmar. So this project has some partnership. So Myanmar Red Cross working with Toyota, the Japanese car company located in Myanmar, so Myanmar branch Toyota company. So Myanmar Red Cross will provide school-based activities expertise and also communication with government office or local community to conduct this training. But then to receive support from Toyota car company for financial support and also technical expertise on road safety education. So this has been launched last year, I think. So the age group targeted by this program is grade 3, grade 4 in Myanmar, which is age of 7, 8, 9 years old. So primary school students. And this program has been developed through the consultation with teachers and school authorities and also engaging students. And they develop materials, teacher material, students book, and also some guiding note for teachers to facilitate this program. And based on some evaluation and pilot, they further improve the materials. And this year they have been conducting this training and also continue improving the project manuals, taking into account all the inputs coming from the training. So the key is to engage all of the key stakeholders, which are of course students, children themselves, and support from teachers. And not only teachers and students at schools, we need to receive support and understanding from parents. So this manual has different lessons, as you can see on the screen. So 7 different modules. So sign and indication, vehicle takes time to stop, visibility be seen, safe crossing, wearing helmet, wearing seatbelt, safety on the bus. So all of these important, crucial knowledge for children to understand. So these are all covered in this manual. So again, as I mentioned, when this manual was developed, Myanmar Red Cross engaged some teachers to get their feedback and comments to improve this manual which was supported by Toyota. And building on that input, they also conduct pilot in some schools and continue developing, improving, taking into account all of these advice from teachers to make it more effective or more efficient. So since this year, beginning of this year, Myanmar Red Cross has been conducting township training, targeting teachers and also Red Cross volunteers. So mainly targeting teachers as facilitators for them to conduct this training in their own schools. So it's a training of trainers, and teachers are the ones to facilitate, but also to have Red Cross volunteers who can give peer-to-peer approach to students, younger generation who can be closer to the students. So this is also, yes, township training. So one training in general, it has 30 school teachers, 2 volunteers. So this is the standard training module. And reviewing, using the manual and conducting the training for the teachers, and the teachers to sorry, this, thank you. So for the teachers to understand first, and then they conduct training for students back in their schools. So this is the modality for this project. Can I go to next slide? Yes. So yeah, basically, Myanmar Red Cross colleagues continue rolling out this project and always trying to get feedback and analyze effectiveness, efficiency, and to make it even more meaningful for children and youth at school. Yep, again, so this is the same training. So it was just a short introduction, but I think road safety is not always priority areas for school safety, but again, this is very important, one of the important agendas as well. And I'm sure Myanmar Red Cross will be happy to share this manual if any of you or any other organizations are interested in receiving this manual. What kind of guiding notes are there? So I also enjoyed listening to other speakers' presentation today, and I really feel school safety is a huge area. We have a lot of things to cover, thematic and also number of schools we have in the region or in the world. And to make children and youth safe and resilient, we need collective efforts. So different organizations, different approaches, sharing ideas. So I really feel this kind of webinar is a great opportunity to learn from each other, share ideas, and to further discuss what can be the best approach. So thank you so much, and I hope I can represent Myanmar Red Cross presentation well. And if you have any questions, I'm happy to connect with Myanmar Red Cross for more details. Thank you. Thank you, Renal. Thank you, Miyagi.
Thanks, Miu. Thanks very much for taking over as well. That was the experience sharing from the Myanmar Red Cross, highlighting the road safety, capacity buildings to increase behavioral change as well. And there was also like capacity buildings for the teachers. We do have a few minutes to have the discussions, questions and answers. And I think we do have 30 participants around joining us online. First, there are questions for Dr. Marla and also for all these presenters. So first questions going to Dr. Marla. When it comes to your public awareness and public education key messages, how can we do differently for now as government officials and DRR practitioners from different countries and agencies to ensure a common message on disaster risk reductions that should be delivered specifically for girls, boys, and school communities? Do you have any tips, Doctor?
Well, okay, I'm going to refer to collective impact theory, which tells us that if we want to accomplish anything that's, complicated, we really have to do it together. And none of us have ever achieved it, little organization by little organization. That's why you have so many nice logos there on the ASI letterhead. So, I mean, by using the public awareness, public education, action-oriented key messages, and with each country doing its own national adaptation and adoption, from that point, we really have to share ownership of that whole process and develop a belief in that process, and then really distribute that reference material and continue to work on it and talk about it. I mean, from the examples that I was giving you, you saw that many people have been inspired by this and therefore created some very effective approaches and materials, because they're all on the same page and they're all finally delivering the same core messages. So, for example, in China, the Chinese Red Cross Red Crescent Society, has begun to introduce this throughout all of their chapters nationwide, so that they can really pick up on and mount some cohesive public awareness campaigns. In some countries, they've organized some seminars for journalists. And so, I mean, I think that all of this work has to be ongoing. It doesn't ever get done. The hardest thing for us is that, it's not accomplished in the course of a 1 year, 2 year, 3 year project. It's a very long-term undertaking. So we need to get our folks together in these multi-stakeholder coordination mechanisms that we have at national level. I think, in each of your countries, you have some kind of multi-stakeholder coordination mechanism. The one for school safety tends to be, very robust. So we should use that. We can use that to do more than just, influencing school safety. And one of the other questions was about, what do we know about how this is done? And there we do now have research showing us that the role of children and youth can be very, very pivotal in getting action at the household level. When children bring interactive materials home that require the family to engage with them, and then they, for example, in China, they did this as spring break homework. And the uptake from spring break homework was phenomenal. I mean, we could really measure what had been done. And now they were able to use social media and WeChat to actually, there was a QR code on the family safety plan, and the kids were told, when you do your plan, please use the QR code and tell us what you've done and this and that. So even the process of monitoring has become, very, very easy. And we need to start taking this stuff viral, I guess is my view. And we can, once we're in agreement on it, and once we're all together on it, and once we collaborate instead of everybody doing something different, I think, a lot more can be accomplished.
Yeah, second questions was from Vanda, and second questions from Mary Echo. That's about the communication side as well, the mode of delivery. Thinking into which mode of delivery is most effective for target communities or populations. Has there been any efforts to partner with private sectors like advertising agencies or advertising experts to support the communications? Given they are experts in behavioral change campaigns and communications.
Hi, Renal, and hi, everyone. This is Mil again. Can I maybe share one of the options or ideas I also put in the chat group?
Right. Yes.
Yeah, so although it's not advertising company, but we do APCSS, we are working with Prudence Foundation and Cartoon Network on this Safe Steps Kids program. So it's actually Safe Steps itself for targeting adult. It was mentioned during the presentation of Dr. Mara. So it's based on the key messages on DRR and safety message, targeting community or public to be aware of the actions they should take in case of emergencies of disasters or injuries, first aid or road accidents, so road safety. So based on the success, this year, Prudence Foundation in partnership with Federation, APCSS, and Cartoon Network, we have this KIDS program using cartoon characters as a voice, as a messenger or ambassador to disseminate safety message to the children. So I think this is one of the great ideas to really reach the children in a children-friendly manner, and not just adults talking to them what they should do. Or this is also a great example of engaging and empowering children through the cartoons. So if you click this website, which I share the link, you will find some videos on disasters and first aid when this happens, what we should do in a very short, clear, fun message. So I think according to the targets, according to the needs, according to the context, we can think of different ways of engaging people. So if we target children, this is one of the great ideas, I think. So yeah, if you have any questions on this one, I'm happy to also answer. Not now, but maybe later or whenever you can. I'm happy to offer any information. Thank you.
Thanks very much, Miu, for sharing that really concrete examples of the partnerships between private sectors, FRCs, and also cartoon networks as well. We can actually see that like already online, and thanks for sharing the link. Dr. Marla, do you have any more inputs, or do you want to respond as well to Mary's questions about effective communications delivery for the messages, for the key messages?
The only other thing I would like to say about effective message delivery is, all of these, creative, child-friendly, we've done some of this with cartoons, and some with drama, and some with, child participatory video, and some with, but I think, we need to test all of these ideas and see what works, and be careful not to say, oh, we've done that before and it didn't work. Sometimes we didn't do it well the first time. And there are so many factors. Even the design of materials are a big factor, right? And so you could say, you could have the same content, but the graphic design is completely different. I would love to see us do some real research on this, and try 2 different designs and see if one design is more effective than another. But for sure, the evidence is telling us that whatever it is we do, it has to be interactive. We have to engage and pull people into the process. So it's not just, telling people. There needs, and on the other hand, we have to do this so efficiently, don't we? Because, we cannot do this one by one. We will never get it done if we can't find a means of getting this to spread on its own. So all of our efforts, I hope, will be towards seeing, how we can make things something effective that will go viral.
Yeah, I'm afraid we are a bit running out of time, but then we can actually stay for a few minutes and to accommodate 2 questions at once. This is related to the inclusions. No, I think it was already mentioned throughout the whole presentations from Ling Ling, and also there is also elements there in Professor Sakurai's presentations as well. One is about the traditionals or custom practices integrated into our school safety programming. The second one is if there is any suggestions from Lily on tools in terms of removing barriers for people with disability. So tools to implement inclusive school safety and inclusive community-based DRR. So over to you, speakers. Who's gonna go first?
I can go first.
Yes, Ling Ling, carry on.
Okay, so for the traditional one, I want to respond. What we do, and I feel it works, is working with children, working with youth. Children, youth, they can be the agent for changes in their communities, no matter how deep their traditional or cultural barriers are embedded. Children and youth, they can work, they can rock their adults to change. Currently, we have youth children groups in the communities, and also in a project area we work in Bangladesh is quite remote, the area. And also the wards is the smallest unit of the community. So many and very remote. It's very difficult to reach all for the activities. But by organizing different groups of children and youth, and then we empower children and youth, and they become the leaders in the communities. So they run everywhere to disseminate the message. And also I watched a show, they organized themselves. A show is telling people you shouldn't leave anyone behind during emergencies, even they are girls, even they are disabled girls, even they are pregnant women. So their community people could understand. They don't talk about any theoretical things like, oh, this is this, this is that. They only watch the show and they understand and they know what they should do. So that's, if you ask me, I think that's the best way I see so far. Work with children, work with youth, work with them, and then they could help you to remove those kind of cultural or traditional barriers. And then another colleagues, they asked me about how to remove barriers from person with disabilities, especially the specified, like they cannot see. Being honest, in our project schools, when they do the baseline, we didn't find anyone, they have difficulties of visibility. They are not registered to the schools. And also we know and we understand there are so many different types of disability, but in the schools, we can only see person with impairment of mobility. They couldn't move well, they use wheelchair, or they don't use wheelchair, but they have difficulty to move as other people. That's the most we see, or they have kind of how to say that, the injuries in their body, but they can hear, or they don't speak very well, but they stay in a school. For the very special schools, you may call it special schools, we call it in China sometimes. So they are all people with kind of different impairment. But in the project area we have in Philippines, in Nepal, and also in Bangladesh, it's an integration. So all they stay in this school, we work. And then the type of the disability is more about mobility. So for this type of disability, we work together with them. The more what we do for them is for the infrastructures and also the services I mentioned before is accessible for all. All means also the person they have difficulties, they use wheelchair. So for the steps, for the stairs, previously they used that one to access to the classroom. We change it so wheelchair can access to it. And for some buildings, like they have 4 storages, and it's difficult to change it. So we changed the system, the service wise. So there is always in a class, for example, it takes turn, and then 2 classmates help this person use wheelchair to carry him to reach to the 3rd floor, for example. So they take turns. Today is these 2, tomorrow the other 2. So every week, different 2 person help this person. So it's kind of service. And for the drills, people with disability, more about mobility. And then for the evacuations, there is also arrangement. Like in a classroom, teacher is assigned, or 1 or 2 person are assigned to help him or her to move out together. Sometimes they are the last one, but sometimes are not, according to the drills. So it's not yet like very inclusive already to meet all different types of the disabilities, because we don't have this kind of person stay in the schools. For those, they have difficulties to move, or they need equipment. We don't give them equipment such as wheelchair. It's difficult. They have wheelchair or they don't need wheelchair, but we try to have the infrastructures, the environment, repaired or rebuilt to meet their needs. And also the service from the contingency plans, from the drills, from the regular activities. That's what we do so far. I hope I answered your question. Thank you very much for reading this to me.
Thank you, Lili. We might want to have like one more questions addressed to Professor Sakurai. That's about the local knowledge perceived in the planning in school safety. How do we want to integrate this local knowledge or local wisdoms when we are developing school safety programming?
So as I said that, each school has now that the DRR, liaison committee with the community. So when they plan the disaster response manual, sometimes at the school and then community together work to identify local disaster risk, and then also listen from the community people about their past disasters, like the flooding, earthquake, tsunami. So all the people in the community knows what happened there. So this is very important to get the community involvement in the planning. And then also, like as I already texted to everyone that, especially after the recent disaster since 1995, Hanshin-Awaji earthquake, the affected Board of Disaster, affected areas, Board of Education produced the sub-reading materials to convey the disaster experience to the next generation, which is used in the classroom for the current generation to learn what happened in the past. So this is also, we have some facilities like a museum on disaster risk reduction, or like a disaster experience to tell the people what happened in the region or in the city by the disaster. So there's not only at the school, we also have that kind of facility to be utilized as a disaster education or extracurricular activities. Is that answering your question?
Yeah, I think so, Professor Sakurai. So it's more of not only specifically on the schools, but also getting into the community as well, all people sharing the past experience with the disasters with younger generations. And in Japan, for example, there's also museums of disaster risk reductions. And Ling Ling just also mentions about when it comes to disability and inclusions, it's not only focusing on the people with disabilities, but also educating the whole community as well to support and to create a systems for all people to not be left behind. So I think we have time. That does it for today. We do have the polling, and I think it's ongoing, the evaluations polling. I'd like to wait for another minute to have everyone participate in the polling.
We still wait for 8 person who need to put the polling, please.
All right then, so now we're about to launch the result of the polling. Right. So thank you very much for the participations for the whole webinar and also the polling as well. So we agree that we found it very interesting to have all of these presentations coming from our experts and speakers. So kudos and congratulations for the speakers and for all the active participations from the whole audience of the webinar. The next webinar, the 4th webinar, would be happening in October. We're going to invite you and all of these stakeholders related to school safety as well. I also took notes some of the questions that were not accommodated and answered by our speakers. I'm going to follow this up through separate emails and address it to specific speakers as well. And I hope the speakers could also help us answer the questions. So for more inputs and suggestions for the next webinar, including the topics of the webinar, you can contact Melly as our knowledge management specialist. So that does it for today. Thank you very much, everyone, for the active participations, and see you at the next webinar. Thank you.
Thank you all.
Thanks, everybody.
Thank you so much. Bye. Have a good rest of
Thank
the
you,
day.
Marlene, you, Lingli, and also Professor Aiko. Thank you all.
Thank you very much, everyone. Have a nice day.
Have a nice day, everyone.